Hello everybody, this is just a short video on sinus tachycardia. We want to first look at the rate. Your rate is going to be greater than 100, and this of course will be greater than 100, but it will not exceed 160 beats a minute. So this will separate it from SVT. Sinus tach initially will increase your cardiac output, but after a while we'll see a drop in blood pressure because this continued increase in heart rate will decrease your coronary perfusion time, your diastolic filling time, and your coronary perfusion pressure, and it's going to do this increase in myocardial oxygen demand, which is not real good for your heart muscle. So some of the things that cause a sinus tachycardia will be your increased sympathetic stimulation, which is a normal response to physical activity, anxiety, pain, stress, fever. Some drugs will cause it, like epinephrine, atropine, caffeine, alcohol, nicotine, cocaine, aminophylline, thyroid medications. So in this case, then we would want to assess the patient for other things like hypovolemia, dehydration, because that will initially cause an increased pulse rate and decreased urinary output and a decreased blood pressure. So we want to look at the cause. So your first treatment plan for sinus tachycardia is looking at the cause and looking at your patient. Do you have a patient that has fatigue or weakness, shortness of breath, orthopnea, decreased oxygen saturation, increasing pulse rate, decreased blood pressure? These are all some symptoms, but look for the cause. What if they have a fever? So you want to treat the fever. If they have pain, you want to treat the pain. But if they're complaining of chest pain, or palpitations, a little bit of chest pressure, that's probably from the increased cardiac demand. And so you want to get a 12 lead and make sure that they are not having an MI. So treat the underlying cause, teach the patient to avoid substances that increase the cardiac rate, like caffeine, alcohol, and nicotine. The way we manage it is we want to treat the underlying cause, give them, if that doesn't work, if there's no underlying cause, then we just want to give them some beta blockers to reduce the heart rate and decrease the myocardial oxygen consumption. And if it is a cause, of course we can give Tylenol for fever, which is an antipyretic, and of course something for pain to treat the pain. So again, the desired outcome is to decrease the heart rate to normal levels by treating that underlying cause if there is one. All right, well, thank you.